National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. Hypothyroidism is a very common condition in Canada. In fact, it's one of the most common conditions I see in my office. Oftentimes, I'm a little extra aggressive and I often like to diagnose hypothyroidism when it's what we call a subclinical condition, which is before it actually shows up on the blood tests. I'll typically use a lot of symptom diagnosis for this one because by the time you actually get the official diagnosis of hypothyroidism, your thyroid has been quite badly damaged and it's going to take you a lot longer to recover. The key thing there though is that you can recover it. The thyroid, as long as it hasn't been too damaged and as long as you can get at the underlying cause of why you have the hypothyroidism in the first place, you can actually treat it and hopefully one day be able to either use less of or not have to use any medications at all to manage it. So what hypothyroidism is it's the underfunctioning of a gland in your throat called your thyroid. And what your thyroid does is it actually regulates your basal metabolic rate. It regulates your metabolism. I often joke with patients it's the thermometer of the body because when it's underactive, one of the things that you're going to see is that person's basal body temperature is going to be on average lower than the average person. And the reason behind that is their metabolic rate has been decreased. So they're burning less energy, producing less heat. And so of course that's what's going to drop their basal metabolic temperature, or what we call the basal body temperature. So if you have hypothyroidism, you may experience symptoms such as excessive fatigue, depression, constipation, dry skin, dry hair or hair loss, right down to thinning of the eyebrows. There's a whole variety of presentations with this condition. You don't necessarily need to have them all. Not every patient experiences every symptom of this condition, but as you can see from the conditions, it can be quite debilitating because of course, you might sleep 12 hours a night, and you just have no energy in your day. Or you might try every laxative on the market and still can't figure out why you can't manage your constipation. It could all actually be related back to that thyroid gland. So the thyroid gland, how it functions is it actually takes two major nutrients, tyrosine and iodine, and it puts them together to make what we call your thyroid hormone. And this is what is going to be secreted by the thyroid gland. And there's two versions of thyroid hormone. There's your T3 and your T4. And what the thyroid gland typically does is it produces an inactive thyroid hormone, which is then activated at the external tissues of the body. In fact, much of your thyroid hormone is activated in the liver, and about 20% is actually activated in the intestine. So it's a systemic hormone, and that's why it has this large variety of implications for your health, because this hormone needs to be activated and used all throughout the body. So hypothyroidism can, actually be caused by inadequate production of the thyroid hormone, but it can also be inadequate activation of thyroid hormone as well. So in order to manage that, you're going to want to look at all the different steps that are involved in normal thyroid function, try and determine which of these steps is not working properly, and then figure out how you're going to support those. So I actually find oftentimes in my practice, underactive thyroids are related to gluten sensitivities and in a lot of cases full-blown celiac disease. And that's because of what we call cross-reactivity, where sometimes the immune system mistakes the gluten peptide for part of the thyroid or for a thyroid receptor, and that can cause what we call an autoimmune hypothyroidism. And so in this case, what's happening is the immune system is impairing the function of the thyroid. So for people with that, we need to eliminate those allergens or eliminate those triggers for the immune system, and oftentimes we'll start to see the disease process go away over time. Then of course what we need to do is rehabilitate that thyroid. And so important nutrients, and again, one of the most deficient nutrients in Canadians is iodine. Because our country was covered by glaciers, we didn't have a lot of iodine deposited in the soils by the sea, and so it's almost endemic in Canada to have an iodine deficiency. So I often recommend supplementing with iodine, or a great natural source of iodine is often seaweed, so using things like dulse and kelp, all the variety of seaweeds can be a great way to get some more iodine into your diet, or look at supplementing with some form of iodine as well. This can be very helpful because a deficiency of iodine will lead to hypothyroidism. Also look at supplementing with things like selenium, as it's required by the thyroid receptors. So even if your body can make adequate levels of thyroid hormone, it may not be able to listen to that hormone. So ensuring adequate levels of selenium is very important. And then of course, anything that can help reduce inflammation of the thyroid, especially if that's the major cause behind the disorder. So again, looking at things like fish oils to help lower your body's systemic inflammatory responses can be very effective. And even things like probiotics. Because about 20% of your thyroid hormone is activated in the gut, ensuring a healthy gut is really important, and probiotics will help do that. They can help reduce inflammation in the gut, and they can actually help stimulate normal function of the intestine, which will result in normal metabolism, normal activation of that thyroid hormone, and that can actually be the difference between, functioning at 80% and functioning at 100%. So if you do suffer from hypothyroidism, or at least some of these symptoms I discussed, I hope this video has helped you out. Check out more of our natural health videos, subscribe, and if you have any questions or comments, post them below. And always remember, knowledge is health.